I'm Jess. I am 24.
Hey there, my name is Elizabeth. I am 21 years old.
Hi, my name is Angela. I am 35 years old.
Hi, I am Mariana. I am from El Salvador.
Hi, I'm Sam. I live in Connecticut. I'm 16.
My name is Ashley Ante. I'm 32 years old.
I have dysautonomia.
And I have dysautonomia. They suspect that I also may have lupus or Lyme. This all started for me back in March after a car wreck.
I was diagnosed with POTS, postural orthostatic tachycardia syndrome, about 2 years ago.
In May of last year, when I was 15, I was diagnosed with EDS, which is a connective tissue disorder. And a few months later, I was also diagnosed with POTS.
And earlier this year, I was diagnosed with major anxiety and OCPD, which caused me to have POTS.
And I was diagnosed with postural orthostatic tachycardia syndrome at the beginning of this year, so March of 2017. I also have mast cell activation disorder. It's commonly found in patients with dysautonomia. They can't figure out the link, but it's, I believe, 30% of POTS patients also are diagnosed with a mast cell related disease.
My very first group of symptoms started, earlier than school age. And I had my first full pass out when I was 5 years old. I had a choir concert at school, and I was on the bleachers that they have singing, and I realized something was really wrong. I started to get really hot, really nauseous, weak, dizzy. I couldn't even stand. So I was very embarrassed because there was a ton of people looking at me. We were during our recital. So I took everything I had in me and I ran out that door of the auditorium, and my principal caught my head right before it hit the ground. We knew something was really wrong. That's not normal to just pass out. So
I actually started having symptoms when I was about 12, but I was just diagnosed with orthostatic hypotension at that point. So the first time I passed out was when I was 12, and on our morning announcements at my middle school, which of course, middle school, what a great time to have something embarrassing happen to you. But I was making an announcement, and I reached the end of it, thankfully, and just hit the ground after that. And I remember laying in one of the clinic beds and hearing a nurse in the other room say, "Oh, we just had a girl pass out. She was so nervous to be on the TV." And I remember being so angry because I knew that wasn't what happened. I wasn't nervous. I performed plenty. I was not nervous, but I couldn't explain what had happened. So of course, I underwent a whole slew of tests. They thought I was anemic. I wasn't anemic. Finally, they settled on a diagnosis of orthostatic hypotension, and I was given Florinef to help treat that. And I've been through all the different doses that you can be on it. Don't really tolerate the highest dose very well, but my doctor always listened to me when I said maybe we can try to taper off, or maybe I need to go up one. So that was good to have that. But as a 12-year-old, and then through my teenage years, I was always told, "Oh, this is very normal for girls your age. You'll grow out of it." Well, here I am at 24, and I haven't grown out of it yet. I even still got somebody tell me that I might grow out of it. I guess I can hope, but I'm not thinking that's going to happen. When I moved, I got to go through a whole bunch of tests again and actually got the diagnosis of POTS.
In my case, it took me several visits to different doctors to get it diagnosed, and also taking several medications to get it controlled.
finally, I had a Holter monitor, and because heart problems are rampant in my whole entire family, and they gave me a Holter monitor, and on that Holter monitor, my heart rate would go to 175 out of the blue. My resting heart rate's 55, so 175 is a pretty extreme difference. Then it would drop down in the 40s. So that doctor just basically said, hey, something's going screwy with your heart. We don't know exactly what it is, but it goes really fast, it goes really slow. Okay. So he said, drink some more water, maybe you're dehydrated. Left it at that. There were all these things that were adding up, and the doctor at the time looked at me and he said, I'm going to put you in for a tilt table test. So he scheduled me for the tilt table test, and they stood me up, and within 3 to 5 minutes, I begged to be put down. And before you know it, I wake up and there's women over me and I'm completely soaked and I don't know what happened. All I remember is when they stood me up, I knew something was immediately wrong. I felt that sensation starting and I'm thinking, what the heck is happening? I had no experience with tilt table, knew nothing about it. So she stands me up, and then before you know it, I'm begging to be put down, and she looked at the other nurse and they said, we can't put you down. And at that point, I passed out and had seizure-like activity, woke up, and they told me I was positive for POTS.
School was very difficult for me, and in high school was a straight A student, had some B's here and there, never missed class, and then in college when I started having symptoms of this, I couldn't go to class. I was constantly missing class. I was constantly having to leave early or passing out, and we couldn't find a diagnosis. I went through so many doctors and so many misdiagnoses before we came to this one because I look so normal.
I hadn't realized that the anxiety I was feeling was not actually anxiety. It was in fact the tachycardia. My heart was just going so fast, and I always assumed it was just I was nervous about something. I'd never quite made the connection. So like I said, I have POTS and I experience tachycardia. I get very sweaty but cold when I'm going to pass out. It sounds like somebody turns the volume down, and so I can't hear properly. My vision tunnels out until I can only see black. And basically I can't think straight. My brain feels like it's turned off.
Well, they started to get worse. I would have them now even lying down. I'd wake up at like 2, 3 in the morning, profusely sweating and feeling like I'm going to throw up and go to the bathroom at the same time. And I couldn't really have enough strength to hold my body up. So when these episodes would occur at like 2, 3 in the morning, I'd run to the bathroom and I'd end up on the floor and rip my shirt off because I was so hot and the bathroom floor was cold, and it would make me feel a little bit better having cold on me. And my head would be at the base of the toilet touching it because it was cold and wet. It's a really gross feeling. The best way to describe it, it's like you're going down on a roller coaster. And you're going to throw up and go to the bathroom at the same time, and you're not even strong enough to hold your own body weight up, not even to hold your head up, not even to yell for help. My episodes are pretty serious when they happen. That happened regularly.
I'm always short of breath because my heart is working so hard. So like talking, I get short of breath. Walking, I get short of breath if I stand for too long. Blood will actually pool in my feet, so my legs and feet will start to swell and they'll turn bright red. And because all the blood is in my feet and not in my head, I do get blackouts, vision changes, so my vision will get blurry. And on really bad days, I will pass out. Basically, my autonomic nervous system doesn't work like a normal human's should, so it doesn't regulate I guess it doesn't regulate positional changes. My heart rate is usually very, very high, even just like laying down, so when I'm sleeping.
Now all of a sudden, it's a struggle to even get off the couch most days. I spend the majority of my time on a blood pressure cuff or an O2 sat monitor and worried that I'm going to hit the floor and die before my family gets home in the evenings.
It's not uncommon to find me in a store sitting on the ground because I've just been walking around too much. As a POTS patient, you kind of learn where your symptoms are, and if you feel faint at all, you just sit down. Like, it's normal for me to, like, people I live with to find me sitting down in the hallway for 5 minutes until I feel better and can get up and move around again.
As an adult, I am still extremely limited. the showering thing, the standing to put on makeup, the going out with friends, the not being able to play with my kids, the not being able to stay up late thing. On the regular, I am nauseous. I would say 23/7 instead of 24/7. There's days where I'm not nauseous. 90% of my life, I am nauseous, like debilitatingly nauseous.
So some coping mechanisms that I have are always trying to find a seat nearby. Wherever I am, even if I don't even realize I'm doing it, I always know where I can sit nearby. And if I can't find a seat nearby, that makes my POTS symptoms even worse, because then I get nervous and the adrenaline kicks in, and it just makes everything so much worse. Salt. I eat a lot of salt. I love salt. I really, really like sea salt. Put it on as much as I can. The banana bag oral solution has been really great, especially when I have to do something like physical therapy, when I know that my symptoms are very likely to act up. I tell people I'm really not shy about having POTS, so anybody who might potentially be in a situation where I might have a problem, I tell them that I have this, and not to worry. Of course, when you tell somebody that you just pass out sometimes, of course they worry, but I always follow that up with a please don't call an ambulance if I pass out. If I hit my head, or if I don't come back around, then you can call an ambulance. But if I just pass out, I'll come to, I'll be fine. I'll just have to nap for the rest of the day and try to let my body reset, but don't call an ambulance. You always have to have some sort of exit strategy. It's just an extra step of planning.
And here are some tips. Drink a ton of water. Shocking. Everybody knows that. Yes, you need to drink more water. You need to increase your salt. Compression. Pump your legs if you're standing somewhere. Keep yourself out of the heat. Air conditioning. If you're going to go outside, I got to be by a pool. Limiting my stress has been key to taking it down a little bit, to making my episodes not come as often or as bad.
Very high sodium diet, which is very, very difficult to eat healthy and be high sodium. It's really sad, but sometimes ramen is my 3 meals a day just because I'm having a bad POTS day. And sodium helps you retain water. So usually I try to drink 3 liters of water a day, and then mix in some Gatorade in there as well. The hardest part about having these illnesses is they're all invisible. If you were to see me right now walking around, I look like a normal 21-year-old. Besides the hives on my face, I look healthy and happy and like I can live a normal life, but the truth is I am so sick that I've had to drop out of college because college professors aren't a fan of you passing out in their class all the time, or having to go to the ER 3 times a week because you've had to stab yourself with an EpiPen.
I just think it's very important for you to try and stay positive and find your own niche in life, because you're going to be indoors a lot. You're going to be laying down a lot. The minute I feel an attack coming on, I will lay down immediately and get, my kids know, cold rag and a bucket for mommy. Mommy's sick again. And it happens all the time. But my daily life is very limited because I'm extremely nauseous all the time. And my attacks, I pretty much got them to the point to where I'm not passing fully out. I'm like pre-passing out. And that's a pretty horrible feeling, and it actually lasts a long time for me. And after those episodes, I am weak and tired for days on end. So yeah, it's definitely difficult to have it.
It's very interesting though, because I'd never really thought of POTS as a disability until one of the faculty members in my graduate program mentioned to me that he wished I had told him that I had this earlier, because then they can report and kind of, get looked at better if they show how they are accommodating to different disabilities. I really had never thought about it as a disability before that. I pretty much only thought of it as some sort of quirk of mine that I just had to deal with. So that was eye-opening. Kind of made me look back through middle school, high school, undergrad, and now a little differently, which was interesting.
I think that it's very important for you to know that we can look fine and not be or feel fine. I've been sick my entire life. I've been judged my entire life for being invisibly ill, and I am very...
People don't see that. They only see you in the moment, in the current moment. They don't see what happened 5 minutes prior. So that's something a lot of us deal with.
People think that dysautonomia isn't a big deal because when I get dressed and do my makeup and fix my hair, I'm still a very attractive person. There's no disfigurement. You can't look at me on the outside and tell that there's anything wrong on the inside.